So it is about to be my great honor to introduce Sean Duffy, who is co-founder and CEO of Omada Health, and his keynote, which is titled The Next Era of Behavioral Medicine. And I just have to own for a second how extraordinary it is that we are at Connected Health. We are at a digital conference, a technology conference, a digital health technology conference, and our keynote today is about behavioral health. And I think sometimes I get very impatient that we're not moving along faster and getting more done. And we should take a second, I should take a second, to really appreciate typically the behavioral health conversations in the olden days, as in 2 years ago, still would have been like in the smallest room available, and maybe there would have been 15 people and it would have been airless. And here we are, and this is the keynote that we're having. I also love the fact that the keynote is by Sean Duffy, who is not from a background in behavioral health. His background is in design. His background is in life. His background is in how to use technology to help people survive the real challenges of chronic disease, the day-to-day challenges of living with health conditions, given all the other contextual environmental factors that we face on a regular basis. And of course, behavioral health is central to surviving disease. And I think one of the things that as an industry we're coming to realize is we need to think of behavioral health almost as the anchor store, the anchor tenant, if you will, of the good health, good life shopping mall that we're trying to build. And I think one of the things that hopefully Omada, that Sean will talk about today, that has been central to Omada's success is what they do is connect the people that they serve with other humans. And Susanna Fox has a phrase I love, that we all need a just-in-time someone like me. The support groups that were formed for the Framingham Heart Study, they stayed together for decades. Why? Because humans need humans. And humans need a human like them. And sometimes I think even more important than connecting to survive a disease is connecting with other humans to help survive life. So it's a great honor to invite onto the stage Sean Duffy. Yay!
Hello, good morning. So I'm Sean Duffy, co-founder, that you saw a sneak preview of what I was about to show. I'm Sean Duffy, co-founder and CEO of Omada Health. As Alex mentioned, my background's a little bit atypical. So I worked in technology and design after studying neuroscience and behavior in undergrad. Ended up going to medical school here in Boston at Harvard for a brief bit, and got really inspired by what I think is a fabulous confluence that's happening right now between technology and medicine. So the talk is titled The Next Era of Behavioral Medicine. And given that we're in Boston, I'm going to start with something that's close to home. So does anyone out there know what's on the screen here? So go ahead and yell it out. Ether Dome, exactly. So this is the Ether Dome. This is the top of the Massachusetts General Hospital. And this is where ether as the first general anesthetic was pioneered. And as you can imagine, before you could put someone to sleep before giving them surgery, it was really hard to do advanced surgical operations. So this is a picture from the mid-1800s of one of the early operations of someone under ether. And they're operating on a neck tumor that would have been previously inoperable. Whenever I see this picture, I sometimes laugh and really hope that they figured out sterilization shortly after. You'll notice that nobody's wearing gloves there. Not a good thing. But in any case, the invention of ether, this new moment of technology, this new kind of creation, had a catalytic effect of an entire discipline of surgery, right? You could do way more in different ways. You could do more advanced procedures. And it also, of course, spawned the discipline of anesthesia. But without that, you wouldn't be able to have what you have today, which are operating rooms and really procedures that absolutely feel like miracles. They feel like absolute miracles. So I think that we're having this exact sort of moment right now in behavioral medicine, thanks to the new ways that people use technology and are able to connect with one another through technology. So I'm going to talk a bit about that. So our mission at Omada is to inspire and enable people everywhere to live free of chronic disease. We've built a program called Omada that's targeted toward individuals that are at high risk of diseases like diabetes, heart disease thanks to their weight, and we help them make lifestyle change in a very behaviorally forward way to result in weight loss and reduced risk of disease. And the everywhere piece is what really gets me going. This is our mission. It's as painted in the walls of our offices in San Francisco, because the everywhere is the hard bit. And I think that technology and design are enabling massive scale of these programs, and also massive innovation of what you can do with these programs. And it's important because the epidemiology, as everyone here knows in the room, is quite scary. For the first time in global human history, preventable chronic disease is killing more people worldwide than infectious disease. I was actually talking to some folks from the Gates Foundation yesterday. Obviously, historically, the Gates Foundation has been focused on infectious. They're going to continue doing that, obviously, but they're even broadening their horizons to NCDs, non-communicable diseases, just given this reality. I was reading an article in The Economist that estimated by 2025, even in sub-Saharan Africa, preventable chronic will be killing more people than infectious. So it's a catastrophe. It's a catastrophe in the US. It's a catastrophe across the globe. One sobering stat in the diabetes space is one that the CDC put out about 9 months ago, in that, on given trend, 40% of adults in the US will at some point find out that they have a diagnosis of type 2 diabetes. So really staggering stats. And it's a cascade and a progression. We've got about 27 million Americans in the US with type 2, about 87 million according to CDC at risk or with prediabetes. Folks relatively reliably progress from prediabetes into type 2 if nothing is done. That's really the control arm of most of the studies in this space. And the beautiful bit is there's actually a lot of foundational literature that shows what can be done. Yet, historically, it's been quite hard to scale because it needs a heavy instrument. So the data that you're seeing on the screen here are from a trial called the Diabetes Prevention Program. It's now one of the most cited studies in prevention. And they took 3,000 people, randomized them. All these individuals were at high risk for type 2, so they had prediabetes but had not crossed into type 2. They brought 1,000 through a really intensive lifestyle program. I mean, this was a very costly intervention in person, really a drop in the paratroopers approach to help people make a lifestyle change in a very behaviorally forward way that led to weight loss over a sustained period of time. They tried a drug, they tried metformin, and they had a placebo arm. And what happened was you saw an immediate split in the conversion from prediabetes into type 2 between the arms. So at 3 years, there was a 58% risk reduction in the conversion from prediabetes into type 2 diabetes in people that went through the lifestyle arm. And there are now 15-year data showing this. You can slow, which is an amazing clinical outcome, or in some cases prevent the progression of diabetes through just a high-touch program right at this tipping point. So this trial was published in 2002. It kicked off a wave of translationalists thinking about how to get these sorts of programs into practice. Colloquially, they're increasingly being called intensive behavioral counseling programs, and it led to this cascade that I think is having an incredible impact on the country right now, and internationally as well. So all the academic momentum to try to propagate these sorts of programs led to an Affordable Care Act provision called the National Diabetes Prevention Program that gave the CDC the megaphone to try to standardize and propagate these programs across the country. We incorporated about the time that was funded after learning about it with the ambition to help scale it through tech. Since then, the American Medical Association has picked diabetes prevention as one of their 2 key focus areas. The ADA is behind it. There are 2 Preventive Services Task Force recommendations strongly endorsing this approach and these programs both be rated. And then in a really landmark decision, Medicare is in the process of designing a reimbursable benefit for these programs. So huge cascade. I think this year and next are an enormous tipping point for how the health, our health system at large can address and treat at-risk individuals. The challenge has always been, though, that the gold standard looks like this. And the gold standard looks like this for the reasons that Alex mentioned. If you unpack the efficacy in a lot of these programs, what you typically find is it's sometimes the soft stuff that matters. It's a recipe of social support, feeling like you're not alone, feeling like you have guidance, structure,